I'm Brandon Hayes-Lattin, and I've been asked to give an overview of progress since a report that was published in 2006 that many in this room are familiar with, but hopefully many of our audience may not be. And that is a report from the National Cancer Institute on progress in adolescent and young adult oncology. And to set the stage, prior to this report, I think the community of both providers and patients, patient advocates, had pockets of deep understanding of some of the issues that you've heard about. That includes that young adult cancers are unique. These are a different set of cancers than the typical pediatric or older adult cancers. And in many cases, incident trends and survival outcomes were different, and in fact, not keeping pace. At the same time, both patients and their advocates as well as providers understood that the treatment of cancer in this age range was in the unique context that Karen just described. And to sort of balance what's unique about cancer and what's unique about the adolescent young adult in and of itself was new. So that spurred a deep look at, well, what's really known and what's unknown about the topic of adolescents and young adults with cancer. And as you've already heard, that's when the age range of a diagnosis between 15 and 39 was started. At the time, this progress review group coalesced recommendations in 5 broad categories. And I'm going to try to stick to these categories when I talk a little bit about the progress in the last 5 or 6 years. So number 1 was to identify what characteristics really distinguish the unique cancer burden in the adolescent and young adult oncology patient. And again, this was meant to be broad, both in terms of biology of the cancer, biology of the patient themselves, for instance, how they may tolerate treatment, but also the underlying context of care that you just heard about. The second recommendation was to provide education, training, and communication to improve awareness, prevention, access, and quality of cancer care for young adults. And as I think back over the time period of this report, really the issue of awareness has been one of the major aspects of progress. I think really coming out of 2006, the notion was, well, there's a whole bunch of things that nobody knows and they need to start hearing about. There's a bunch of background that is really underappreciated. And really that awareness has been a major improvement. The third recommendation from the Progress Review Group was to create tools to specifically study the AYA cancer problem. And this was important because even in the background research at the time of the Progress Review Group, it was often difficult to pull out that 15 to 39 age range because it was a new cohort that hadn't been described well before, and there weren't really tools to examine. The fourth recommendation was to ensure excellence in service delivery across the cancer control continuum. And so this really meant taking some of the stories that we had heard about delays in diagnosis all the way through differences in treatment based on setting to the unique needs of palliative care in young adults, and really examine what we could do to increase the excellence of service delivery. And the fifth recommendation was to strengthen and promote advocacy and support for adolescent and young adult patients. If you think about the sorts of advocacy and support systems that are formalized in organizations across the country, many of them were founded by adolescents or young adults who recognize a particular need, unmet need during their cancer care, and that has spurred them on to create an organization to make a difference. And part of the recommendation of the PRG was to really coalesce those and broaden their impact. Many of you know that at the publication of the report of the Progress Review Group, it was a unique partnership with Livestrong Foundation, in which Livestrong actually convened an implementation group who created a strategic plan based on the Progress Review Group report. And that implementation group was known as the Livestrong Young Adult Alliance. This was a program of Livestrong Foundation that actually amassed organizations both on the medical side and on the advocacy side to tackle the recommendations of the PRG. And as many of you know, that alliance has evolved into a Livestrong supported but independent organization called Critical Mass, where that work is continuing now. So it's a challenge to quickly go through progress in these areas, but let me just give a few highlights in terms of the first bullet point, distinguishing characteristics of adolescent young adult cancers. Within this recommendation are things like elucidating the unique biological characteristics of these cancers, but also the unique life stage and developmental characteristics of this age range. And to identify and ameliorate health disparities that are experienced by AYA cancer patients and survivors. And just to give some highlights of work that has been done since 2006, there was a large effort to examine some of the common cancers among AYAs in retrospective ways to try to understand if there were clues to biological distinctiveness. And there are now published retrospective analyses that show in various degrees at least evidence to suggest there may be biological distinctiveness in a wide variety of these cancers: osteosarcoma, colorectal cancer, ALL, breast cancer, testicular cancer, and thyroid cancer. There was also a dedicated workshop hosted by the National Cancer Institute in 2011 that looked specifically at ALL, breast cancer, and colorectal cancer, outlining some of these biological distinctive characteristics. But in addition to the basic biology, there have been reports looking at other aspects of unique characteristics of this population, including health-related quality of life, epidemiological trends, which Archie just updated, toxicity, comparing therapy in sarcoma or ALL in adolescents and young adults versus young children, and their experience of distress. Within the second recommendation of education, training, and communication, the recommendations focused on raising awareness of AYA cancer issues, providing targeted education to a broad array of constituents, both providers, caregivers, and the public, and to educate multidisciplinary providers who work with these patients to improve both referrals and services in the population. And in terms of examples of progress in this recommendation, there have been medical education programs from societies of influence, including ASCO and their Focus Under 40 online curriculum, the Nurses Oncology Education Program, as well, with the nursing education module called At the Crossroads. With regard to training, the Livestrong Young Adult Alliance published a position statement on the components that we felt were necessary for all healthcare professionals who work with adolescents and young adults with cancer. And in terms of general communication, there were a lot of activities that often surrounded a National Young Adult Cancer Awareness Week that included a lot of media outreach. In terms of creating tools, at the time of the PRG, the recommendations included things like creating a large prospective database of AYA cancer patients to facilitate research, increase the number of annotated specimens to support biological research, to create or modify needs assessment tools to be specific in this population, to improve things like grant coding and search terms so that we could actually dig out some of this retrospective data we were looking at, and expand clinical trials for adolescents and young adults. This was the population with the lowest participation rate in clinical trials. Some highlights of progress in this category include efforts to really amend clinical trials with regard to their age of eligibility, such that more clinical trials might be available in the kinds of cancers that affect adolescents and young adults across various settings. A primary example of progress has been in acute lymphoblastic leukemia, where the principles of a pediatric modeled therapy were applied in a clinical trial setting across multiple adult cooperative groups. Livestrong, through the Young Adult Alliance, funded a adolescent and young adult cohort feasibility study in which there was an attempt made to actually gather adolescents and young adults at the time of their diagnosis and to follow them prospectively and look at, can these patients be followed? Will they follow up? And in fact, that was feasible. And as Archie has shown in other settings, the search term tools probably make a difference because in addition to focused work on this, if you do just a PubMed search for adolescent and young adult cancer, you see a dramatic increase in hits from 2002 and really all time back. There were only a couple of hundred hits per year, whereas last year there were 5,232. The fourth category, service delivery, included things like developing, evaluating, and disseminating standards of care for these patients, and to establish a national network or a coalition of providers and advocates seeking to achieve standards of excellence. Progress here obviously included convening the Young Adult Alliance, which is now critical mass, and efforts to recognize and support excellence in service delivery. For instance, Fertile Hope's Centers of Excellence program recognizing fertility preservation efforts. The Livestrong Young Adult Alliance published another position statement on the elements of quality cancer care for adolescents and young adults. And more recently, the NCCN has published recommendation guidelines for the care of adolescents and young adults. And then the final category from the Progress Review Group was advocacy and support to address the subjective experience of adolescent and young adult patients, to build capacity among those existing resources I mentioned, and to evaluate existing programs and develop new interventions. One of the principal ways that we have seen progress in this has been through the annual meetings of Livestrong, Young Adult Alliance, and now Critical Mass, where that alliance membership has grown to over 350. And combined efforts among both medical and advocacy organizations. And one example here is an International Charter of Rights for young people with cancer. Having said that, there are certainly continuing opportunities within the recommendations from the PRG, and to highlight a few of those. In terms of characteristics of what is unique about an adolescent and young adult and their cancer, we need ongoing support of research, both in terms of the unique biology of the tumor and the unique biology of patients in this age range, but also support for research on the influence of the life stage and developments on outcomes that are important. And really, the next step in the field for outlining what those research priorities ought to be is something you heard Archie mention, a workshop hosted by the National Cancer Institute this September. In terms of education, training, and communication, I think the field really is at a turning point of evolving from the notion of raising awareness as the principal target to formalizing some of those components, whether that be requirements in educational curricula or certification standards. In terms of developing tools to study AYAs and their cancers, I think this remains a really critical need. There have been some efforts at examining AYA patients within the tools that exist. But just to take the bullet points out of the PRG recommendations, the creation of a large prospective database of AYA cancer patients to facilitate research. Again, there are efforts. There was a feasibility effort I described. There's an effort also funded by Livestrong Foundation looking at patients in the context of survivorship across multiple institutions. But to link that with biological specimens in a prospective way is a remaining need. To increase the number of annotated specimens, many places are increasingly gathering biospecimens, and I think there has been an evolution of how to annotate such that we are capturing things like the age of the patient correctly at the time of that sample, but also at the time of their diagnosis. But there's a great opportunity to leverage the networks of individual biorepository efforts because many of them will only have a small proportion of their specimens actually representing AYA cancers. And so that's an effort that I think remains a need. And then creating and modifying assessment tools that are specific to AYAs. So again, I think you heard about a lot of the issues that AYA patients face, and there are efforts trying to have a deeper understanding, but we don't really have a screening tool. We don't have an assessment tool for AYA development within the setting of cancer. In terms of service delivery, there are ongoing efforts to either certify programs or apply guidelines in adolescent and young adult oncology that many of us in the field think are really fantastic. But I think there's a real opportunity to continue to work to coordinate those efforts and so that we minimize overlap and maximize their impact. The next is documenting the impact of outcomes. So there are a lot of, because of an interest in a new field, there are a lot of, I think, sort of individual experiments of how do we deliver service to adolescents and young adults with cancer, whether that be creating hybrid models of care, applying new clinical trial strategies to increase enrollment. But I think as we do this, it's going to be really important for us to document what works. And that's an important part of continuing service delivery. And then within advocacy and support, since 2006, I think we've amassed a really impressive array of medical institutions and advocacy groups that focus on at least components of the adolescent young adult cancer issue. I think the next opportunity is for us to really detail, in a detailed way, map what that network looks like so that we can both increase the reach of the organizations that have a part, but we can also find what gaps still exist. In terms of those future efforts, obviously critical mass is working to help be a site for that sort of coordination I was describing. Within the clinical trial and biospecimen world, the promotion of the National Clinical Trials Network and particularly a focus in adolescents and young adults within that through efforts like the AYA committees in COG and a newly created AYA committee within SWOG are a major effort. In terms of research priorities, again, we want to plug this NCI workshop in September where that's an opportunity to really look at what's known and what the future priorities should be. Models of care and service delivery. Many places are experimenting with AYA cancer units. In fact, there's an effort that you'll hear more about in the future from Teenage Cancer America to spur that on. And recognition, again, there's future efforts looking at that, including an organization called Change It Back that will be applying a Centers of Excellence program. But boiling it all down, to summarize, if I were to pick 3 priorities for us in the context of the National Cancer Policy Forum to advocate, these are what I would choose. Within research, I think if I think back to both the efforts that led to the PRG and a lot of the efforts, really the success and progress that have come out of the PRG, it has been championed by individuals across a number of organizations. But I think importantly, it's been championed by the NCI and the CDC and their internal efforts. And I think we all need to work hard to support that those efforts continue, that there continue to be a major focus within the NCI and the CDC to do this work. Tools. As I tried to explain before, I think that we really have an opportunity to take research within adolescent young adult oncology to the next level. One example might be to continue to work to fund these large-scale prospective efforts that are inclusive of biology, of therapy, of support, and looking at those effects on outcomes. And then evaluation. I think a lot of what's happened since 2006 has been awareness and promotion and experimentation about how do we care for these patients. But I think going forward, it's going to be really important for us to document what outcomes are important to adolescent young adult patients and to really measure the effect of our AWA-specific efforts on those outcomes. So that's what I have. Thanks.